Welcome back. In our last episode, we talked about osteoarthritis, which is caused by mechanical wear. Today, we are talking about something much more dangerous, rheumatoid arthritis, RA. If osteoarthritis is a flat tire on your car, rheumatoid arthritis is the engine catching fire. According to Johns Hopkins Medicine, RA is an autoimmune disease. This means your immune system, the soldiers meant to protect you from viruses, gets confused. It identifies your own joints as the enemy and launches a full-scale attack. This is not getting old. This is a civil war inside your body. And unlike osteoarthritis, RA is systemic. The Arthritis Foundation warns that the inflammation doesn't just stay in your knees. It can attack your eyes, your lungs, and even your heart vessels. That is why we treat this aggressively. To understand the pain, we need to look at the anatomy. In osteoarthritis, the hard cartilage breaks down. But in rheumatoid arthritis, the immune system targets the synovium. The synovium is the soft lining that encloses the joint fluid. When the immune system attacks it, the lining thickens and swells. This is called pannus. Think of pannus like an invasive weed growing in your garden. It grows thicker and thicker, releasing destructive chemicals that literally eat away the cartilage and the bone underneath. This is why RA causes deformities, twisted fingers and bent toes, if left untreated. The pannus destroys the structural integrity of the joint. So, how do you know if you have it? RA has a very specific signature called symmetry. According to the Mayo Clinic, rheumatoid arthritis usually strikes both sides of the body at the same time. If your right wrist hurts, your left wrist probably hurts too. If your right knee is swollen, your left knee is likely swollen too. This is the biggest clue. Osteoarthritis is usually asymmetrical, maybe just your bad knee from an old soccer injury. But RA is a systemic attack, so it hits everywhere evenly. Also, look at the small joints. RA loves the knuckles in your hands and the balls of your feet early on, whereas OA often hits the big weight-bearing joints first. Here is the final test, the clock test. When you wake up in the morning, your joints will feel stiff, like rusty hinges. But how long does it last? In osteoarthritis, you move around a bit, and you feel better in 20 or 30 minutes. Motion is lotion. In rheumatoid arthritis, the stiffness is stubborn. The American College of Rheumatology states that RA stiffness typically lasts longer than 1 hour. Sometimes it lasts all morning. You might feel like you are walking through mud or wearing heavy gloves. If your stiffness takes 2 hours to fade away, that is a massive red flag for RA. If you suspect you have RA, do not just wait and see. You need blood work, but be careful. Many general doctors only check for one thing, rheumatoid factor, RF. Here is the problem. According to the Mayo Clinic, the RF test can be misleading. Healthy people can have high RF, and people with severe arthritis can have normal RF. It is not perfect. You need to ask for a specific test called Anti-CCP. Think of Anti-CCP as the fingerprint of rheumatoid arthritis. If this test is positive, it is 97% certain that you have the disease, often years before symptoms appear. Your doctor should also check your ESR and CRP. These are inflammation markers. They tell us how hot the fire is burning inside your body. High CRP means the war is active. Low CRP means the war is quieting down. Once you have a diagnosis, you're in a race against time. Rheumatologists talk about the window of opportunity. This is usually the first 3 to 6 months after symptoms start. According to the American College of Rheumatology, if you start aggressive treatment within this window, you can put the disease into remission. You can stop the bone damage before it starts. But if you wait, if you say, "I'll just take ibuprofen and see if it goes away," you miss the window. Once the bone is eroded, it never grows back. The deformity is permanent. This is why we do not treat RA with just painkillers. Painkillers are like painting over a crack in the wall. You need medicine that fixes the foundation. So, what are these medicines? We call them DMARDs, disease-modifying anti-rheumatic drugs. The gold standard is a drug called methotrexate. I know, if you Google it, it says chemotherapy drug. Do not panic. In cancer, they use huge doses. In rheumatoid arthritis, we use tiny doses. It helps retrain your immune system to stop attacking your joints. If methotrexate doesn't work, we move to the modern miracle, biologics, like Humira or Enbrel. These are targeted missiles. Instead of suppressing your whole immune system, they block specific proteins, like TNF-alpha, that cause inflammation. They can be expensive and they are usually injections, but for many people, they are life-changing. Finally, we have to talk about lifestyle. There is one habit that is absolutely toxic for RA: smoking. According to the Arthritis Foundation, smoking is the strongest environmental risk factor for developing rheumatoid arthritis. But it gets worse. If you already have RA and you continue to smoke, the medicine won't work. Studies show that smokers usually have a poorer response to methotrexate and biologics. If you want to stop the pain, putting down the cigarette is as important as taking the pill. What about diet? The Mediterranean diet is your best friend. Focus on fatty fish, salmon, sardines, olive oil, and nuts. These are high in omega-3s, which naturally lower inflammation levels in the blood. To wrap up this rheumatoid arthritis masterclass, this diagnosis can be scary. The idea of a chronic autoimmune disease sounds heavy, but medicine has changed. 30 years ago, wheelchairs were common for RA patients. Today, thanks to early diagnosis, anti-CCP, and advanced treatments, biologics, remission is possible. Most patients live full, active lives. The key is action. Do not ignore the morning stiffness. Do not ignore the symmetry. Get tested early, treat it aggressively within that window of opportunity, and protect your joints for the future. I will see you in the next episode.